Welcome back, everyone. It's a new season of Impact and Innovation, and we're actually picking up right where we left off. So the last episode of Season 8 was with Tegan Engel, and we were talking about food as a driver of health. And today I'm with Josh, the founder of About Fresh, which works on food as medicine. And so we're going to pick up on the last conversation and build on it further. So first of all, I want to welcome Josh. Thank you so much for coming, for driving up from Brooklyn to talk to my students, and for podcasting with me. It's such a joy to have you here.
Thanks for having me. I'm excited. Had a great day so far.
So let's start by just introducing About Fresh so that our listeners aren't wondering what it is, and then I'll ask you some questions.
Yeah, sure. So About Fresh is a national nonprofit. We've been around going on 13 years. Started off really grassroots, but have grown into an organization which engineers and scales solutions that embed food into healthcare financing and care delivery. So the biggest part of the work that we do now is called Fresh Connect, which is a technology platform that enables health plans and providers and community-based organizations to cover the cost of healthy food for low-income households across a network of 13,000 grocery stores all over the country.
Okay, I'm going to ask you for more detail, but first I'm going to frame it a little bit in the trajectory of social drivers of health. So in the last episode, we were kind of talking about like food justice and nutritional security and those types of like movement building aspects. And today we're going to really zoom in on placing food within the healthcare system.
Sure.
And how food as medicine work. Am I accurate in saying that your nonprofit basically exists in the context of food as medicine? And if yes, will you describe to our listeners what food as medicine means and how it works?
Yeah, sure. So, food as medicine means a lot of different things to a lot of different people, and we actually.
So maybe it's not the best term to use.
No, I think it's okay, and I think it's really important. We certainly exist in no uncertain terms. We exist in the context of food as medicine, and I can talk more about like why we don't love that term and how it is that we sort of conceptualize the totality of our work and our mission, specifically thinking about all of the different intersections of like why food is important beyond health. It's important to like how we connect with our community, with our culture, with loved ones. If you're food insecure, right, like family dinners break down, cookouts break down, it's a critical source of like our social capital, our power, how we wake up feeling every single day. And so I think that while we exist in the context of food as medicine, we are also thinking about all of those other dimensions of like why food is important to us as people and as a household.
It's not just a means to an end. It's not food for health. It's also food as something people need. Like some people say food is a human right, by the way. The U.S. is one of 2 countries that hasn't signed on to that, I think. But just like people say health is a human right, most countries say food is a human right, like clean water is a human right, education is a human right. So food in and of itself is not a means to an end. But you're right that food as medicine kind of makes it sound like it is.
Yeah, I mean, like, listen, shopping for food, cooking food, consuming food, that's like really happy, really joyful. And going to the doctor isn't, not typically. And so we think the conflation of all of those great aspects of food and a clinical environment just doesn't do justice to the experience that we are trying to create through our program. But I think there is a really important sort of discourse community and that is built up and organized around food as medicine. So we exist in that context for sure.
So what I understood, or at least kind of what I concluded in my head while listening to you talk, was that your passion is helping people get healthy, fresh food, right? And cultural alignment and joy and celebration. And what allowed you to build a business model around it, even if you are a nonprofit, but you need to have some kind of financial model, is this new space that's been built around food as medicine.
Sure. Yeah.
And the way I understand food as medicine to me is just that like when a healthcare provider can prescribe an expensive drug and Medicaid or Medicare or a private insurance company or whoever the payer or health plan is will pay for that drug. But a lot of chronic disease really requires you to be eating healthy food like fresh fruits and vegetables. And so the concept was like, well, why can't the provider just prescribe fresh fruits and vegetables and have that paid for by the healthcare payer, whether it's an insurance company or Medicaid or Medicare? Is that a correct synopsis of the food as medicine concept?
Yes, I think that's right. From the standpoint of embedding food into healthcare financing, that's all right. I think there is also a significant amount of work to do within this movement of food as medicine to think about how food as medicine programs exist operationally within clinical care. Like, how is it that a doctor goes about prescribing food to a patient is still an open question where there is a lot of innovation happening in line with the healthcare financing reforms that are making it possible for payers to cover the cost of food.
So it's not just the flow of
members.
money, but also how do you operationalize that?
That's right.
And it sounds like, is that part of what do both the financing and the operations touch your work?
Yeah. Food as medicine it's a nascent economy. It's not necessarily a brand new movement. It certainly predates About Fresh. Dr. Jack Geiger in the US back in the 1970s is famous for attempting to prescribe food, knowing that he was going to be sanctioned by insurers. And he's famously quoted as saying, the last time I checked, the cure for malnutrition is food. So he's been a pioneer in this movement. And then going back thousands of years, if you look across sort of the diversity of global cultures, all cultures have heritage and tradition in food as medicine. So it's not an altogether new concept. I think it's new from the standpoint that healthcare finance reforms are creating conditions for it to be a meaningful part of our healthcare system. And our work is probably more focused on defining sort of the implementation science and on the side of operationalizing food as medicine inside of healthcare. But by way of our work, we're generating really important data and insights, which we hope can continue to contribute to the innovations that are happening in reforming healthcare financing. So from that standpoint, we are participating in healthcare finance reforms, but we're really builders and operators at our core.
Okay, so this is a good moment for me to ask you about what exactly it is that you do. Tell us more about the specifics of the product and how it works.
Sure. So our Fresh Connect technology platform is sort of our flagship offering. We launched it in earnest about 5 years ago, and it's grown into becoming a food as medicine platform that enables health plans and healthcare providers and community-based organizations, also municipalities, government agencies, to cover the cost of food for people at grocery stores. So it's specifically taking aim at affordability and purchasing power as a barrier towards accessing healthy food. And then specifically thinking about how do we use the existing food system that's already in place that's good at getting food to people as the fulfillment mechanism, sort of enabling people to access food in a manner that is flexible, that is convenient, that is dignified from places where they already go shopping. And so the platform has two core components. One is a debit card, a reloadable prepaid debit card that can be programmed with item level spend parameters based on a patient's health profile. And then a program
What does item level spend parameters mean?
Yeah, so if we go back to kind of the first principles of food as medicine, the goal and the thesis is that we want to embed food into care delivery in order to drive better health outcomes aligned with the patient's dietary health profile and healthcare goals. And so it's important that for us to recruit healthcare as an investor behind our work to, in this case, fund food for people, that we put guardrails around that investment to make sure that it's in line with payer and healthcare provider goals. So the technology that we've developed around Fresh Connect enables our partners, our health plans, and the community-based organizations, and the providers that we work with that use Fresh Connect to do just that, to make sure that they're investing directly into the foods that are aligned with the patient's healthcare goals.
So is it individualized?
No.
Okay.
It's not. I mean, we've taken a very pragmatic approach at the outset of developing Fresh Connect to first make sure we're not being overly restrictive or rigid about how it is that people use Fresh Connect. We don't want to, if somebody's entering into a retail environment using Fresh Connect to go shopping for healthy food, we always want the experience to be really intuitive, really frictionless, and ultimately really joyful.
Yeah, you want them to feel like it's just like any other debit card in terms of the patient experience,
as
right?
much as we can.
Yeah.
And again, too, the reality is that it is a investment by healthcare into an outcome. So there have to be guardrails around the program. But we try to make those guardrails as expansive as possible to still drive the outcomes of better health. So that's one component. That card technology is one core component to the platform. And it's ultra complex for a number of reasons. Grocery item data is really complex. The POS and payment processing infrastructure that we intersect with is really antiquated and really complex, really fragmented. So that's been tricky, but we built up a really great core sort of foundational technology in that area. And then the second component of our platform is a web application that facilitates all of the end-to-end logistics of creating a cardholder profile, loading a card with money, and then it captures the cardholder level transaction data, which importantly, we can tie back to health records, which helps us facilitate all of our impact evaluation, which we use to hopefully advance healthcare reforms, demonstrating the impact of Fresh Connect on health outcomes over time.
So who uses that second part? The patient uses the first part, which is the debit card, and then the back end, is that the healthcare provider or?
Sure. Yeah, I mean, I'll take you through the end-to-end experience of the platform to sort of illustrate both things at the same time. So there's a lot of different permutations for how Fresh Connect can be implemented within a clinical model. But if you can sort of imagine very simply like a patient walking into a health center for a primary care visit and then screening for food insecurity. Within the course of that visit, the provider has identified the fact that the patient is food insecure and also at risk for diet-related disease. That provider can then enroll that patient into Fresh Connect. From there, a patient will receive a Fresh Connect card in the mail, along with like a welcome packet, like letting them know all the basic elements of the program. They'll get a warm welcome call from our team, also welcoming them to the program, answering any upfront questions they have about where they can go shopping, how much money's on the card,
this is
what
so
they can
cool.
buy, and that type of thing.
I'm putting myself in the patient's shoes. I would just be like, this is amazing.
Yeah, it's really it's really human-centered and really simple at its core. It's just more money in the bank to go shopping for healthy food at the places where you already go.
So it's like SNAP, kind of like food stamps.
It's just like SNAP. Yeah. It's just like EBT. We use some of the same payment rails as EBT, actually, that underlie the technology, but for healthcare. It's enabling healthcare to invest alongside of SNAP into healthy food purchasing power.
Which actually should have always been the case. Like, why would healthcare and SNAP be siloed? They're both from the Department of Social Services, you know, like the same government entity.
It's a big open question.
Yeah.
I mean, SNAP is, it's administered both at the state and the federal level. The federal level, the USDA presides over state level SNAP programs. Food as medicine is
more decentralized.
It is much more decentralized even at the federal level.
It's not like an official policy or government offering.
No, it's not. It's not an official government offering yet. There are federally, funded programs. There are some, federally funded programs, including through the USDA, that are a little bit more focused on food as medicine, but the exact payment mechanisms are still coming together.
But this all speaks to something I see so much in public health entrepreneurship and social entrepreneurship in general, which is like these problems don't need to exist, and they exist because the world is so siloed, right? Like SNAP and Medicaid are under the Department of Social Services. They should already be connected. It shouldn't need an entrepreneur to come connect them.
Yeah, I don't have an answer from about why it is that we are siloed from the outset. There's bipartisan and sort of widespread sort of consensus that making sure that people have the food that they need to be healthy is a good idea. Even if it's from a place of pure fiscal conservatism and you're unconcerned with the moral imperative to make sure that people have food. And so, but our government bureaucracy here in the US is what it is. And so our effort right now is to attempt to align like all of those stakeholders and to create the policy and the economic conditions to kind of like realize the potential of food as medicine. Because we know what the potential is. We know that, food is driving billions of dollars in avoidable direct healthcare costs and trillions in adverse economic impact. Like, we know that that's true. We now need to engineer the solution that helps start containing those costs and, more importantly, just the human impacts that are attributed to not having reliable access to the food that you need to be healthy.
And you just described like the beauty and the whole point of social entrepreneurship is that when there is a better status quo, a more fair and just status quo that one might visualize, like a world in which people have access to food as medicine and there aren't these silos. but the government is just bureaucratic and needs political will, and it's not going to get there without a catalyst. The social entrepreneur is that catalyst who's like, all right, I'm going to roll up my sleeves. I'm going to actually design and implement this and show you how it's done.
Yes.
I'm going to, in the best case scenario, take your money to pay for it because you should be paying for it. And then hopefully one day you'll catch up and maybe I'll become obsolete, or maybe I'll become, like you'll be my client or whatever.
Yeah.
But like I will shift the system as it is today, which is siloed and bureaucratic and broken, to a more smoothly operating and more fair and just system. That's what social entrepreneurs do.
Yeah, that's our work. And I think no shortage of legislators share our vision for the future. But I think, our roles as social entrepreneurs and builders is to bring that vision to life. Legislators can help create the conditions. We push them to do that using our data, using our practice, using our insights. But we're ultimately the ones that's in our hands to do it. Legislators too are not building solutions.
Yeah, you take the risk to pilot something and to innovate, because to innovate means to experiment and fail, and governments can't do that.
Right.
So it's kind of like your job is to like come up with the proof of concept and prove that this works, and then it can be adopted and scaled and institutionalized. That's right.
And that's been our strategy, from the outset. There are plenty of disadvantages to being a nonprofit, but the big advantage for us, which was like core to our strategy when we initially launched Fresh Connect, is to prioritize partnerships, new business that helped us drive an agenda of learning and evaluation to build that proof of concept so that we could inspire longer-term sustained investment from healthcare into food as medicine. I think there were other ways to grow in terms of pure scale that maybe would have been more expedient, but that wouldn't have afforded us visibility into the data that we needed to really move legislative advocacy and healthcare practice in the direction of underwriting food as medicine predicated on true clinical impact.
That one thing that you said earlier was really about not just proving the concept, but also being involved in providing the data for the reform and advocacy to happen. And so that's something that came up a lot in class today, is like, you're basically building a tech company, and that's a lot of work. And so how do you balance succeeding in that with then also doing the work of helping to like inform and influence the policy reform that will make this?
I mean, technology is just an instrument. Like, we don't get overexcited about being a technology company. We do need to lean into product as an operational discipline. Like, I've learned a lot about like what it takes to build a highly effective product and what that internal cadence looks like when your motion is really smooth and what it looks like when it's not building product. And I've really had to humble myself to the team of people that are part of About Fresh. We work with a group called Process First outside of About Fresh to build all of our technology. I really had to humble myself to them and their expertise to get to a place where our product motion is smooth so that we can continue to build Fresh Connect at a velocity where, we can pursue all of the different like upgrades to the platform and the adjacent opportunities that we want to. And so that's important, but it's not at the center of who we are. Like, at our core, in preceding Fresh Connect, the original program that we developed, Fresh Trucks, a mobile market, we turn school buses into grocery stores. That's more at the heart of what we do, right? Like, first and foremost, we're a people-centered organization that cares deeply about making sure people have the food that they need to be at their best. And that anchors all of the choices that we make, and technology works in service of that. And our technology also works in service of our systems change agenda. Like, we build our data models, we build our analytic tools. We build our systems for like qualitative data collection in service of affecting systems change. And so to that end, technology is not our identity. It is simply just a vehicle to advance our mission and, to enable us to, affect systems change and get food to people. Technology happens to be how we do it. And it's important, but it's a second order consideration.
That's really refreshing, because it's so common to hear people get so excited about the tech that the tech becomes the point, it becomes
tech
the
is
thing.
great,
and you're just like, this is a means to an end, you know? So that's it's nice to see you kind of like
Yeah.
stick to the mission. But you mentioned your origins, and actually this is a great time to kind of rewind and zoom back and like share that story with us about like how you ended up here and how it all started.
Yeah, I don't know how we got here. I am certainly not like a technologist, although I get accused of being a tech guy pretty often. I get accused of being a tech bro pretty often. So I have to.
You're not a tech bro.
I am. Thank you. Yeah, I appreciate that. It's maybe not such a bad thing too that I've learned to fake it a little bit, but particularly when we're working with like community-based organizations, it is so important to like anchor those types of partners in our origins, because I think there are so many solutions out there that are technology first and are sort of technology in search of a problem, and we couldn't be more different. Yeah, prior to About Fresh, I was a health worker collaborating with clinicians at a small health center in Boston to address like a wide range of non-clinical social needs for patients.
So you were a community health worker?
Yeah, I was a community health worker. Yeah, I was a community health worker in Boston at a health center. And, I was just running like kind of anti-bullying programs at schools. I was doing a lot of physical activity programs for kids. And I was doing a lot of work around nutrition education. And the only grocery store in the neighborhood closed at the same time that we were running this program. And like, we had no answer. I was working at a world-class health system and we had no answer for how to get people food. We couldn't do anything about the fact that all of a sudden that they were just going to be cut off from access. And that brought into focus for me, everything that I've alluded to about like what's important to About Fresh, thinking about, okay, food's an important driver of our health outcomes. It's driving an enormous amount of cost, which creates sort of an economic opportunity for innovation. And it's totally divorced from how we take care of people, despite all of those things being true. And so that's what grounded like all of our initial program design. But the first program that we developed out ahead of Fresh Connect was that mobile market model, Fresh Truck, where we just took a school bus, retrofitted it, turned it into a grocery store, and we started, we just developed this weekly schedule of stops. We'd go 1 to 2 days a week, traveling around, like getting food into communities to address proximity, retail proximity as a barrier towards healthy eating. And that program was super successful. It still is. We have...
Oh, it's still going on?
Yeah. Fresh Truck is in its own independent nonprofit now, separate from About Fresh. But yeah, I have 3 trucks on the road, a great e-commerce platform, and sell like $2.5 million of food all around Boston. And that experience afforded us the opportunity to like cut our teeth in food retailing and understanding like what that user experience looked like, what some of the constraints and challenges are in delivering like a really delightful, culturally attuned consumer experience within the course of grocery shopping. And so, the things that we had to start to confront in service of our mission of like getting food to a lot of people, making sure that it was affordable, making sure that it was culturally aligned, or one, that we were only ever in a neighborhood for 1 to 2 days a week for a couple hours at a time. And for low income, stressed out folks experiencing food insecurity, it's just like, it's a lot to ask.
Yeah.
And then we really wanted to be able to offer more foods, but we were limited in terms of our ability to expand our inventory, given that we were operating inside of the confines of a school bus. And then physically, we're just kind of bottlenecked in terms of how people can move through. So we couldn't
it's a school bus.
So at a certain point too, we couldn't serve more people.
Yeah.
And we couldn't make the lines go faster. And so folks were waiting for a long time. And so we were confronting all of those things. And then at the same time in Massachusetts, in Boston, where we had launched, the state was about to launch a Medicaid demonstration waiver focused on addressing health-related social needs and sort of embedding things like food and housing and transportation into our Medicaid payment model into clinical care in Massachusetts. And so we're like, oh, well, that is an interesting opportunity to think about like, how we can maybe partner more closely with healthcare within the course of that pilot program. And the third sort of element that helped bring Fresh Connect to life was that we had dietitians and nutritionists and social workers, even teachers, like and guidance counselors, like coming to us and being like, hey, I have this like one family, right? They're food insecure. I'd really like to be able to cover the cost of food for them. Like, how can I do that using your mobile markets? And we're like, oh, like we gave them a stack of like, there were little paper coupons at the time that said like $10, said Fresh Truck to the name of like the school or the health center. And they could give those out to patients or, just residences. They were confronting families that were experiencing food insecurity. They'd show up at the truck, they'd spend the coupon, and we just invoice them for whatever showed up. And that was the inspiration for Fresh Connect, is really just thinking about, affordability and purchasing power is we know now is a much more important determinant that constitutes whether or not you have access to food. And also pushed us to start thinking about like how we could move beyond our own sort of verticalized retail model to include other retailers in that program. Like, how can we make it possible for not only this like dietitian to fund food at our trucks, which are, just have all those constraints around how people access food, which are great, super important for a lot of people, but not for everybody, to make it possible for people to go shopping wherever they want, kind of whenever they want, at the places where they already go grocery shopping. And so just that foundational experience was a really important part to the design of the programming and the technology that is Fresh Connect, but more importantly, too, it grounds everything we think about the user experience to this day, and making sure that like we continue to be just culturally aligned and that we deliver on just a dignified, really frictionless, really intuitive shopping experience for all of our Fresh Connect cardholders, even though we're a little bit of a bigger tech company now.
It's really interesting listening to these stories and reflecting on how at every step of the way or every stage of the way, the product and the innovation grew out of your own experience. Like as a community health worker serving this community, and then the grocery store shut down, and like you just needed to get groceries to them, and you started Fresh Truck. And then as Fresh Truck, you were having clinical providers being like, well, we want to pay for this for people. And you started with coupons, and then it turned into technology, and now it's Fresh Connect. And I wonder what's going to happen next. But regardless, it's just important
we
for
have some ideas. Yeah.
Okay, cool. I want to hear those next. But like thinking about our listeners, and some of them might be thinking about them wanting to be an entrepreneur. And it's just like, just get out there and get involved in whatever it is, this topic that you care about or this problem you care about, and just immerse yourself in it for a long period of time so that the solution will emerge, right?
I think it's that, but I think it's always making sure that you're operating from first principles, right? Like if we got overcommitted to like Fresh Truck as the invention, we couldn't have gotten to Fresh Connect, right? Because Fresh Connect and Fresh Truck couldn't be more operationally and tactically different.
Right.
Right? Like one is addressing proximity as a barrier. The other one is addressing affordability as a barrier. One is a school bus, like this operationally intensive, like human capital intensive, very logistical kind of like grocery retail model. The other is a fintech platform, right? But we were married to our mission over and above the invention, and we remained committed to those first principles of like, how do we get food to people? How do we embed food into healthcare payment operations, into healthcare payments and clinical operations? And by remaining committed to those first principles, we could continue to innovate. But if you overcommit to whatever the invention is, you get stuck inside of that constraint of like, how do we make this school bus mobile market better? So certainly proximity to the problem is ultra important. Like all of those experiences, that closeness to the people that we were serving, that experience operating as a grocery retailer, like my experience even before that as a community health worker in a clinical setting, super important. I think too, just like I actually don't know how you build super effectively without sort of developing that like institutional knowledge in whatever area it is that you hope to innovate. But I think that discipline of remaining committed to first principles has to accompany that frontline experience in whatever area you're attempting to innovate.
Yeah, that's really important advice. Be married to the problem, not the solution, right?
That's right? Don't
lose sight of that. Another thing that came up, first tell me the ideas. You said you have a lot of ideas about what's next. Or is that still kind of in stealth mode?
I have, nothing's in stealth mode. Like if somebody goes and does it and it's not us, we'll cheer for them. I'll say we're thinking about the intersection of local food. So we obviously have like a ton of conviction in the efficacy of like Fresh Connect, and given the magnitude of the issue that we're attempting to address in the order of billions, if we could conceivably unlock like tens of billions of dollars of healthcare investment into medically tailored meals and prepaid sort of grocery benefit card programs like Fresh Connect, which, amounts to consumer purchasing power. Like, wouldn't it be special if we could drive a large proportion of that to like local food economies, more growers and more independent retailers, which has cascading economic impact in terms of like job creation and economic justice. Like, not to mention that like localized food systems typically have like much more humane, favorable, just labor practices by comparison to our broader food system. So that's an area of innovation for us that we're super, super excited about, that we're thinking about a lot. You know, another theme of innovation that we're thinking about a lot of is the role of community-based organizations. We still think of ourselves as a community-based organization, but we used to be a small one, right? We were operating Fresh Truck as a mobile market.
Yeah, very
hyper-local to Boston. Now we're operating in 15 states. We have grocery retail network in every state. And there is a world where like we build this verticalized program where we just keep standing up Fresh Connect programs in every single state. And we own contracts directly with these health plans and providers in the state to administer Fresh Connect statewide. There's another world where we tap into the grassroots community-based infrastructure and trust of community-based organizations that, by the way, have been doing food as medicine work for a long time, but perhaps lacked the sort of technology infrastructure and the backbone and the secure kind of like backbone and data sharing capabilities to contract into health systems. So and this is something we're already doing. We're thinking about Fresh Connect as a technology backbone for community-based organizations to deliver food as medicine. So this like really decentralized ecosystem of food as medicine, that as opposed to us attempting to like grow in a way where we become the ecosystem.
Interesting. I
so
like that.
Yeah, I mean, so like, you know, practically speaking, we have a great partner in DC called DC Greens. They've been running, like they're one of the most well-respected produce prescription food as medicine programs in the whole country. And they really sort of initially developed their program using like wooden tokens, for example, and then they actually like experimented with a lot of their own technology. We've been really fortunate to be able to partner with them simply as the backbone of their program. Like their program that operates in DC is not Fresh Connect. It's DC Greens produce prescription program.
Okay.
Fresh Connect is far into the background of that, but they are so effective at running that program, and it bears out in the data because they have roots in community. So all of the wraparound sort of program engagement operations that have to accompany the technology and the delivery of Fresh Connect are driven by their team that, you know, just has the cultural dexterity, the muscle memory, the history, the connections, the regional knowledge to just make the most out of a food prescription program in a way that we never could. And so we're really thinking about the learnings from that partnership, amongst others, to build Fresh Connect more intentionally for CBOs. And then the last one that we're excited about is sort of a vision we have that we call full stack food care, which is really thinking about how we can create a more unified experience around how, you know, healthcare providers, you know, payers and community-based organizations deliver the full range of food as medicine programs in a way that is more unified from the standpoint of like program management, data collection, and then endpoint consumer experience. Because, you know, Fresh Connect and prepaid kind of benefit card programs like us are not the only food as medicine program. Medically tailored meals, grocery delivery, and e-commerce, both really important components of what is comprehensive food as medicine, as are dietitians.
Okay.
And so we want to think about how we can build off of what we've developed in Fresh Connect to not only provision Fresh Connect cards, but perhaps those other types of like food as medicine programs wrapped in medical nutrition therapy or other types of food-focused behavioral health. So that's what's up next for us.
Yeah, I love this for you, especially like the second to last and the last idea you shared in terms of like you being like the backbone and the back end of what someone else is delivering, whether it's another CBO or another food as medicine company or something, but just building this like connective tissue and this integrated ecosystem. My students and I jokingly refer to this as extrapreneurship, right? It's not like about one company at a time. It's about like innovating beyond the boundaries of multiple institutions, and you're really thinking of it not as an intrapreneur or an entrepreneur, but as an extrapreneur, which I love. Another thing that came up a lot today was, well, first of all, let me ask, who's paying for all this? I never really explicitly asked you yet, and some listeners might be like, wait, how is this working financially? Yeah,
sure. So there is a diversity of payers that are underwriting Fresh Connect. So we're, you know, we heavily concentrated in like Massachusetts, which has an 1115 Medicaid waiver that expands the allowable use of Medicaid dollars to cover the cost of non-clinical health-related social needs like food, housing, and transportation. We're focused on continuing to grow across states that have those Medicaid waivers. So in that instance, it's really the state that is the ultimate payer by way of a network of healthcare providers that are taking care of Medicaid patients. Limited amount of funding from like health plans. That's an area that we're beginning to explore more in earnest, but not really a market where we've engaged in deeply yet. And then we have a really prominent network of philanthropically sponsored demonstration pilots, which is really where the core of our research is happening. And then, to a lesser degree, some like just municipal sponsored funding outside of the Medicaid system is also powering some Fresh Connect programs, but really too, and where, who the payment source is on the back end doesn't matter a whole lot to us. We can take anybody's money and get it into the hands of people that need a little bit more to go shopping for healthy food.
So that brings me back to the question I was going to ask before, because it came up a lot during class, which was you're doing all this as a nonprofit, which I think makes sense for you. But is there anything that you feel you're missing out on? Any like missed opportunities, or like there are others doing this work or similar work as for-profits? And so what are some tensions you've experienced in terms of running a tech platform as a nonprofit? Like, why did you choose nonprofit? Would you do it this way? Would you consider going a for-profit venture-backed route? Or just talk about some of the pros and cons?
Yeah, I've thought about that a lot. And there are a lot of downsides to being a nonprofit versus like more of a traditional like for-profit. And I think you can actually have it both ways. But I think it's important to perhaps like stage out the progression of your corporate structure like really thoughtfully. In service of your mission, if that's your endpoint goal. And it is for us, right? Like we are totally allegiant to like our mission and our systems change goal. And there's no compromising on that for us. And I think given the nascency of food as medicine, I think given the imperative for generating evidence, some of the skepticism that probably still exists within the healthcare market, not about the overall efficacy of food as medicine, but the conditions under which food as medicine can be effective, is more well matched for a nonprofit at this point in time if we want to achieve our systems change goals.
Because there is a market failure, right?
Yeah, there is right now because we don't have enough evidence to inspire large-scale investment into food as medicine predicated on clinical impact. There are for-profit food as medicine companies that are doing a really good job contributing to some degree to the evidence basis and sort of the operational practice of food as medicine focused on clinical outcomes. But I'd say the vast majority of like what we consider to be for-profit food as medicine innovation that's happening is more so connected to health plan member engagement, which is a radically different value proposition than driving bottom line clinical outcomes. So if we want to remain committed as an organization to our goal of long-term systems change, and driving healthcare investment into food as medicine oriented towards clinical outcomes, we have a higher bar to clear in terms of evidence, which I think is better suited for nonprofit. Like VCs don't want to fund like a lot of that early research to build a market, not over the time that I think it's going to take.
And they want to see returns faster, and this takes like...
Yeah, and I think too, if like we raised even impact-focused like venture funding, I think we'd have had to make a different set of decisions about how we focused our go-to-market plan, at least at the outset of like starting Fresh Connect. It's like much more zero-sum. I think we are perhaps now better positioned to maybe balance some of our purely mission-driven, like a longer-range systems change and impact goals, leverage for philanthropy, and also venture-sponsored growth, venture-sponsored commercial growth, coinciding with like commercial returns now that we're like a little bit bigger and a little bit more sophisticated and have demonstrated some proof of concept. So I think that that's something that we're evaluating. But I think for us, the advantage of being a nonprofit is that we could grow slow without the downward pressure to monetize, focus on learning and evaluation without concern for top line. Of course, we're always concerned about our sustainability. And even our philanthropic funders want to understand what the longer term line of sight is towards sustainability. But we were able to really principally focus on generating the insights and the data to affect systems change. There's always an appetite, though, I will say, and this is the frustrating part about being a nonprofit, to just scale. Like, we just want to get more Fresh Connect cards into people's hands and give people more money to go shopping for healthy food over a longer duration of time. And philanthropy is transient, it's scarce.
Do you think impact investing could play a role, or some other kind of patient capital where it is for profit?
I mean, I don't know what any of those things mean, right? Like, it's like patient, like you ask somebody what 10 different people what impact investing is, you're going to get 10 different answers.
That's true.
Patient capital, I do think, is important. Like, we have more recently talked with a number of investors that have these really radical sort of expectations around IRR, like looking out at over returns over like a 45-year time horizon where all the money gets reinvested back into the fund. That, I think, could be well matched to our thesis for like impact and commercialization, right? Like, that's a pretty good, that gives us a lot of time to like innovate and grow. I mean, it's a complex policy environment at this point in time right now too. And so we are still trying to make sense out of how the current political environment, and as a result, Medicaid funding and Medicare funding are going to continue to expand or contract, and more likely contract into the future, and how that will influence our ability to grow, even leveraging impact-focused patient capital. There's a lot of ways to think about philanthropy as a better match to ensure that we can sustain the work that we're doing and then de-risk our reliance on private markets. So yeah, there's, but getting back to my point about like the frustration of like being a nonprofit, it's just like, it's a lot harder to access the capital that we need to invest in product innovation and growth in particular to realize the potential of Fresh Connect relative to the magnitude of the need. But that downward pressure to monetize, even with like a mission aligned impact investor, I think brings on a little bit of a different decision model that may interrupt some of our systems change goals. So we're at an interesting inflection where we need to think hard about like what the trade-offs are in both directions. Can we hold both? And where do we compromise? I don't have the answer yet, though.
I don't have the answer. I do think that you are juggling a lot and you are making it work as a nonprofit. Like, you've already done so much and you carry a lot. And when you said earlier, a few minutes ago, you said about like, oh, maybe we can have it both ways. I was just like, I don't think you can ever have it both ways in anything in life. I think usually when someone tries to have it both ways, it doesn't work. But I think the way you've been doing it so far has been working. And you've been doing amazing work and growing. And I think you can, especially the way you're thinking about partnerships, I think is really smart. And you're leveraging the financial flows, and how the market is shifting. I think you've been making it work.
Yeah, I think so too. And I think, maybe this is an entrepreneur thing, I think we can have it both ways. I think
I would be very happy to be proven wrong.
Yeah,
I would be so happy.
We're kind of like, we're doing kind of like a lot of like legal analysis and like learning kind of at the intersection of, venture formation, I guess, and all of these different permutations of impact-focused corporate structures, and learning about, impact-focused patient capital and how that universe can coexist with philanthropy.
Because even Rockefeller, which is one of the foundations you work with, they have a lot of impact investing, right?
They do.
They have a venture arm.
They do. And I mean, you oftentimes introduce some complexities in soliciting funding from like
both sides.
From a single institution that provides both like philanthropy and impact funding. Like, there are a lot of sort of regulatory and optical like considerations there. And so which again is part of our learning process around like sort of how we navigate our relationships with institutions in the event that they provide blended capital. And we're not, to be clear, we've like only ever used like philanthropy and some low interest debt, I guess, to fund Fresh Connect up to this point. But we've never taken on any significant amount of money to fund our work outside of philanthropy too. All of our debt up to this point has been relatively modest. But yeah, I think there's definite interest. I mean, like all of our foundations and philanthropies are really excited about our pursuit of alternate types of capital to fund our mission into the future. I mean, there is a world where our mission is congruent with the market, right? If we can successfully prove to healthcare that we are driving down avoidable costs attributed to diet-related disease by using Fresh Connect, but then becomes like a great market opportunity. And then they're ultimately investing behind our mission. And when I think about having it both, once we prove that, then great. That's a great sort of context for us to then leverage like venture funding or other forms of like commercial capital outside of philanthropy. And then having it both ways, then I don't see why we can't use philanthropy to address whatever the leftover market failures are while relying on commercial capital to underwrite product innovation so that we can better focus philanthropy on like the direct costs of just growing our program.
I have seen commercial capital coming from in the health equity space from really impact-oriented investors. So that definitely is an option. And maybe you can find a way to just be like, I'm going to do this and I'm going to continue doing the advocacy and the like foundational philanthropic stuff. So we'll be watching. I think it would be amazing if it worked. What else do you want to tell people? Is there anything I haven't asked you that you wish I had, or just anything you want to share in terms of closing thoughts?
I think just coming back to some of my commentary, like about, food is medicine. I would just like want to reiterate again, like what grounds our mission and our motivation to do our work. Food is such an important part of our like health, and we believe deeply it needs to be ingrained into healthcare at the deepest levels. But I just want to reemphasize like the importance of food beyond health and how central it is to our culture and our ability to connect with loved ones. Like I just come back to cookouts a lot. Like back in the day when we were running Fresh Truck, we participated in or we hosted like just a lot of block parties, and that's the most beautiful part of the work that we do. And that's so much of the future that we're trying to build in addition to all this healthcare and payment innovation that we talk about. We just want to make sure that people have money in the bank to afford the food that they need to be at their best. And we use that word at their best on purpose to encompass all of those other aspects of like why food is important. And I also hope that the work that we're doing now can be illustrative of the universe of possible with respect to like business model innovation and the blending of capital. I've like become, social entrepreneurship and like blended capital using like a combination of philanthropy and impact focused venture funding was something to me that was always theoretically exciting. I hope that into this next chapter, we really figure out like more actionable ways to like leverage multiple different types of capital to address market failures more on the philanthropic side, but to drive really meaningful and aggressive scale on the venture side. And I think we're close. So I'll definitely keep you updated on that. But I'm feeling optimistic about it. I guess I just wanted to leave with that I'm feeling optimistic about our ability to thread that needle. And I think it's becoming even more possible. I think there's beyond us. I think there's just like a lot of creative thinkers that are also trying to thread that same needle. And I'm just hopeful that's going to become more of a feature of like capitalism, like in our economy, and like how we fund really important social ventures.
Yeah, that really gives me hope. And I love the way you circled back to food itself, not just food as medicine kind of has this like sad, like you mentioned, thing to it. Like it's just clinical and it talks about sickness and everything. It's just like food as food, like be a food company, not a food as medicine company. So I do think that is, when I think about that as a direction of growth for you, I feel that that's what's going to happen, like emerging from food as medicine to just being food. So So hopefully next time I teach this course, you'll come back and you will have gotten there or be on your way, and we'll talk more and you'll give us updates.
Be my pleasure. Yeah, I hope I have some good news when I come back.
Okay, thanks so much, Josh.
Yeah, thank you.